The primary efficacy endpoint, visual analog score, looking at your back pain, you had to have at least a 30% improvement at 1 year, no significant adverse events, and at 2 years, our follow-up was very, very good. So we achieved that. In addition, here is what we call the VAS scores. And the blue line I want to show you is this high dose group, if we can see that. And the stars mean that that is statistically significant improvement from baseline. And so what you're seeing here is this stuff compared to placebo, compared to the vehicle alone, separated itself and really worked well. Now, this slide is extremely important, and I'm going to show you for a couple things. ODI is the main functional outcome score. It's used in every single back pain clinical trial I have seen. Now, this is a % improvement from a very high bar. MCID is a 15-point improvement. That stands for minimal clinical important difference. That is what the FDA looks at to say this is substantial improvement. So that dotted line is what's called MCID, and that's what the FDA looks at. You can see that the blue line here is significantly better and statistically significant better than the FDA's benchmark for substantial improvement. Now, let's put that in further perspective. Here is disc replacement, the purple line I just put up. Now, again, why is that important? That's probably our best treatment of overall for back pain. And you can see that it improved 33.9 points, but the high dose group, the blue line, really closely approaches that. Now, why is this again important? The next line, TLIF is the most common procedure for structural back pain done. You can see the results of the high dose group really are significantly better than the standard therapy for surgery. It essentially blows it away. Then finally, I'm going to jump ahead to disc volume. What you can see is disc volume, just picture the disc gradually getting larger. And the blue line shows that again, at 1 year and 2 years, the disc was significantly bigger or better than it was to start. This next slide, I'm going to just show you a patient, and this is probably the most important thing. And if this doesn't wow the people in the audience, I don't think anything will. This is the most impressive thing I have seen in doing spine surgery and clinical trials in 30 years. This is a woman who has structural back pain. She had problems. She tried conservative care. She tried everything. This is the typical patient that's the walking wounded that doesn't want to have surgery. Married, 2 children, a first-grade teacher. This is her MRI. And what I want you to see is if you look here at the bottom, you'll see this disc with a little tear in the disc. This disc is thinner than all the other discs. And that was determined, again, by the process that this is where the structural back pain is occurring. At 6 months, we saw improvement in disc volume and disc height. Now, I want to show you again, this is going to be the most impressive slide I think of today. Over here is the original screening slide, and this is 6 months. Now watch the disc height here and here as I blow that up. Okay, what you see here is this disc is visibly larger and thicker than this disc. Visibly larger and thicker, same thing, same window. Now, why is that important? In all the clinical trials I've done, never have we seen something that will regrow your disc. Never. And incidentally, not only did it regrow the disc, but more importantly, her patient-reported outcomes are dramatically improved. So this is why I'm excited about this visual thing of regrowing your disc. There is no one else out there that has this. This is groundbreaking. This is disruptive, and it has the ability to change everything. And sorry for my going on too much, but it's just so impressive.
No,
it's so impressive.
Yeah.
Why does DiscGenics work rather than other cell therapies? And I don't think we alluded to this, but maybe the audience knows, but the DiscGenics cell is a precursor to the disc cell. So what that means is if we go all the way backward to a stem cell where it could become anything, these have moved along, and they know when they go in the disc, they know they're supposed to be a disc, they're supposed to generate substances that are in the disc. That's why the disc, in my opinion, regrows, is because these cells automatically know where they're supposed to be. They don't have to figure it out, and they grow. And the disc is a very toxic environment. It can be very acidic and all those things. So by knowing that you're supposed to be a disc and then regrowing, that's what makes it so special. There is no one else that has this. No one. It's almost, you can't, in my opinion, comprehend the potential growth because it has the ability to affect individuals without a lot of baggage. And as Ryan said, those products are all associated with surgery. Just picture you get your back injection and you move on, you're at work the next day. You didn't have to miss work for therapy or anything else, and you move on with your life. I mean, it's almost mind-boggling where this could go.